In this video, we're going to look at 3 nerve flossing or nerve mobilization techniques for the upper extremity. Oftentimes, you're going to have irritation of the nerve root where the nerves come off the cervical spine here in the neck. Those nerves go down behind the collarbone here, the clavicle, and then travel down into the arm and hand. Then you're also going to have irritation of those nerves anywhere along that pathway. And if so, a lot of times these mobilizations or nerve flossing techniques work really well. Our first technique is going to be gliding the median nerve. The median nerve is the nerve that's compressed in carpal tunnel syndrome. It travels through here through the wrist and goes in the palm of the hand. So what you're going to do with this one is you're going to take the elbow out straight. You're going to bend the wrist down so the hand is going out like this away from you. I'm going to tilt my head so that my right ear comes towards my right shoulder. And then what's going to happen is I'm going to lean my head, my left ear comes to my left shoulder, and at the same time I bring my wrist and my hand towards me. So I'm going to go back and forth like this. This can be a little tricky if you're not very coordinated. It can take a little practice to kind of work on that. Repeat that for around 15 to 20 repetitions several times a day. Our next movement is going to be for the ulnar nerve. Now, the ulnar nerve is the nerve that when you hit your funny bone, the inside of your elbow becomes irritated. You may have tingling in that small finger here on this side of your hand. So this one, what we're going to do is you're going to make a OK sign or that kind of circle here. You're going to have your hand down by your side and you're going to bring that up, flipping that over, and you're trying to bring it so that you're looking down through that circle. So you're looking down through the circle. So basically what I'm going to do is on the right side, when I bring that back, I'm going to look down through the circle at the floor. So we're going to go through it here. I'm going to look down, kind of tilting my head and bending to the right and then back. And when I come back, I'm going to lean away. And I'm maintaining that position the whole time. Lean away. When I come in, I'm looking down to the floor through that circle and then back away. And then I will repeat that to the left side if I'm also having symptoms on the left side. So you're going to do that to whatever side you're having your symptoms on, repeating that for 15 to 20 repetitions several times a day. Our last flossing technique is going to be the radial nerve. Now, that's the one that's going to travel down the back of the arm, go on the outside here, that's next to where you have tennis elbow complaints. So with this one, what you're going to do is you're going to kind of put your hand back like this, like you're kind of putting your hand back and you're wanting someone to give you a, kind of a low five there, I guess. So you're going to put your hand back like this, and when your hand goes back, you're going to tilt your head to the same side. And then when you bring your hand back forwards, you're going to tilt your head away. So I've got my palm facing away from me the whole time. And when I come back, what I'm going to do is I'm going to bring my wrist back into extension. So here we go. So flexion, I'm leaning towards. When I come back, my left ear goes to left shoulder, and you see my wrist goes into flexion, goes in the opposite direction. So that can take a little practice to do that, but once you get comfortable, it works really well. Complete that one for 15 to 20 repetitions several times a day. You do have the ability just to perform this on the nerve that's causing the irritation or pain. For a lot of patients, they may have pain in the entire upper extremity. They might not can pinpoint which nerve it is or which nerve root that it is. So I have those patients just go through all 3 of those techniques several times a day. Hope this video helps give you an understanding and showing you 3 simple techniques you can do for nerve mobilization or flossing of the upper extremity. Make sure you hit that subscribe button so you can stay up to date on all my content. Thanks so much.